Understanding clinical trials. What follows is a consent form for a trial that is not being carried out right now, but for which you might be eligible if it were. Each page will include narration. Following the narration, please take all the time you would like to review the text, and then proceed to the next page when you're ready. The title of the research study is Randomized Trial of Radiation with Concurrent Cisplatin in Combination with either Antiprov or XR400 for Cancer of the Head and Neck. The principal investigator is Dr. Johnson, and the sponsor is SimCorp. Why am I being invited to take part in a research study? You are being asked to take part in this study because you have head and neck cancer. What should I know about this research study? Your participation is entirely voluntary. You do not have to be in this research study. If you join the study, you can stop or leave at any time with no changes in the quality of the healthcare you receive. You will be told about any new information or changes in the study that could affect your willingness to continue participation. You can ask all the questions you want before deciding if you want to be in the study. Why are we doing this research? The purpose of this study is to test an experimental medication called XR400. We want to find out if it works and test its safety. We want to find out what effects, good or bad, it has on people with your condition. XR400 is a new class of medication that has been shown to block an enzyme that is needed for cancer cells to grow. XR400 may help to stop or delay the growth of new cancer cells in patients like you. SimCorp is the company that created and makes the experimental medication XR400 and other medications. XR400 has not been approved by the U.S. Food and Drug Administration for sale by prescription. XR400 has been tested in animals, in healthy people, and in patients with other types of cancers. How long will the research last? In this study, you will receive treatment for 6 weeks. You will also be asked to visit the office for follow-up exams at 1 and 3 months after the completion of radiation and chemotherapy, then every 3 months for 2 years, every 6 months for 3 years, then once a year for your lifetime. How many people will be studied? We expect about 50 people would be in this study at UMass Memorial Healthcare out of 450 people in the entire study nationally. Will I definitely receive the experimental medication? No. In addition to radiation and cisplatin, a standard chemotherapy drug for head and neck cancer, you will either get XR400 or a medication called Antiprov, which works through a different mechanism to block the growth of cancer cells and is an approved medication sometimes used for patients with your condition. The decision to give you XR400 or Antiprov will be made by chance, like flipping a coin. Neither you nor the study doctor will choose which study medication you get. You will have a 50-50 chance of being given XR400 or the standard medication. Neither you nor the study doctor will know which study medication you are getting. In an emergency, a doctor can find out what you are taking by calling the on-call investigational pharmacist. What happens if I say, yes, I want to be in this research? You will need to have the following exams, tests, or procedures to find out if you can be in the study. These are part of regular cancer care and may be done even if you don't join the study. If you have had some of them recently, they may not need to be repeated. This will be up to your study doctor. Your study doctor will have to send some of your tumor tissue removed during your surgery for testing to see if you have the risk factors required in this study. You'll have a physical examination by several doctors. You'll have an evaluation of your diet and of your ability to carry out daily activities. You'll have a CT scan with contrast. You'll have an MRI of your head and neck. You'll have a PET scan, a computerized image that looks at the activity of tumor cells in your entire body. We will draw blood from a vein for lab tests. Women able to have children will have a pregnancy test. If you are pregnant, you can't take part in this study. What happens during the study? If the exams, tests, and procedures show that you can be in the study and you choose to take part, you will be randomized into one of the study groups. Both groups will receive radiation therapy once a day, Monday through Friday, for 6 weeks, and receive cisplatin by infusion once a week for 6 weeks, a total of 6 doses. If you are in Group 1, in addition you will receive Antiprov once a week for 6 weeks for a total of 6 doses. If you are in Group 2, In addition, you will receive the experimental medication XR400 once a week for 6 weeks for a total of 6 doses. For all patients, if you missed a planned day of radiation therapy, the missed day may be made up by having 2 treatments on another day within the week, given at least 6 hours apart. This way, the overall treatment time, 6 weeks, will remain the same, giving the best opportunity for cancer control. You will need the following tests and procedures. They are part of regular cancer care. When you come in weekly for radiation and chemotherapy, you will have a physical examination, blood tests, evaluation of your ability to carry out daily activities, and evaluation of any side effects from your treatments. If your study doctor recommends it, you will have a CT scan with contrast, or CT PET scan with contrast, and/or MRI of your head and neck, a chest CT scan or chest CT PET scan with or without contrast, a biopsy, and an evaluation of your diet to see if a feeding tube is needed. What happens after the study? At 1 month after the end of radiation and chemotherapy, you will have a physical examination, evaluation of your ability to carry out daily activities, blood tests, and an evaluation of any side effects from treatment. At 3 months after the end of radiation and chemotherapy, you will have a physical examination, evaluation of your ability to carry out daily activities, and evaluation of any side effects from treatment. At 6 months after the end of radiation and chemotherapy, you will have a test of your hearing if your study doctor recommends it. Every 3 months for 2 years, every 6 months for 3 years, then once a year, you will have a physical examination, evaluation of your ability to carry out daily activities, and evaluation of any side effects from treatment. If your study doctor recommends it, you will have a CT scan with contrast, or CT PET scan with contrast, and/or MRI with gadolinium of your head and neck, a chest CT scan or chest CT PET scan with or without contrast, and biopsy. Below is a schedule of study appointments and procedures. In the left-hand column, you'll see a list of all the procedures that you'll be asked to do during the trial. The top row lists all of the times you'll be contacted while in the study. A check mark tells you what procedures will happen at each visit. Please take all the time you would like to review it, and then scroll to the next page when you're ready. What are the risks of being in this study? Risks of the experimental medication include the following side effects of XR400, which have been most commonly reported: mouth sores, nausea, diarrhea, swelling of hands, arms, legs, and feet, fatigue, joint pain, or cough. Other serious side effects could occur. Call your doctor right away if you experience a new or worsening cough, shortness of breath, chest pain, difficulty breathing or wheezing, a fever, or chills. Risks of the standard medication. The following side effects of Antiprov have been most commonly reported: dry or itchy skin, headache, feeling tired or weak, diarrhea, nausea or vomiting, and respiratory infections. Other serious side effects could occur. Call your doctor right away if you experience a severe skin rash, eye pain or vision problems, chest pain, feeling like you might pass out, a fever, or flu-like symptoms. Risks of radiation to the head and neck. The following side effects of radiation to the head and neck are most common. Some may be serious: sores in the mouth and throat, which may be painful, especially with swallowing; dry mouth, changes in taste, reduced sense of smell, some level of change likely to be permanent; thick saliva; hoarseness; skin changes such as swelling and redness of the skin in the area of radiation; pain or pressure in the ear; tiredness; weight loss, hair loss in the area of radiation; and cavities, tooth decay, loss of teeth, or tooth sensitivity. The following are occasional side effects. Some may be serious: decrease in function of the thyroid gland that may require you to take thyroid replacement medicine; damage to the nerves of the shoulder and arm, which may cause decreased movement and feeling; ear infection; hearing loss; and difficulty swallowing, which may require a long-term or permanent feeding tube. The following side effects are rare and serious: breathing and swallowing problems that may require a surgical procedure to create an opening through the neck into the windpipe, damage to the nerves in the head and neck that control sensation, expression, or other motor functions, damage to the jawbone that may cause jaw pain and loosening of teeth, damage to the voice box that may cause hoarseness, shortness of breath, or inability to speak, damage to the skin, soft tissues, or other parts of the head and neck that may require a major operation to correct and rarely can be life-threatening, and damage to the spinal cord that may cause permanent weakness. Risks of the standard chemotherapy drug cisplatin. The following side effects are most common. Some may be serious: nausea and vomiting, infection, especially when white blood cell count is low, anemia, which may cause tiredness or may require blood transfusions, bruising or bleeding, kidney damage, which may cause swelling or may require dialysis, hearing loss, including ringing in the ears, and numbness, tingling, or pain of the arms and legs. Occasional but serious side effects may include allergic reactions, which may cause rash, low blood pressure, wheezing, shortness of breath, swelling of the face or throat, confusion, and difficulty with balance. Rare and serious side effects include cancer of the bone marrow caused by chemotherapy later in life, or seizure. The risks of having blood drawn include slight pain when the needle is inserted. You may develop a harmless black and blue mark, and your arm may be sore. Occasionally, some people feel dizzy or lightheaded when blood is drawn. They may become sweaty, feel cold or tingly, and may faint or throw up. Risks that are possible but unlikely include infection, nerve damage, and puncturing an artery instead of a vein. You will be exposed to radiation as a result of the CT scans. These scans give detailed images of the inside of your body. The amount of radiation a person receives during a CT scan is moderate. We know that radiation is harmful, but the risk to your health is hard to measure. If you have had many X-rays or scans, or if you might be pregnant, you should ask the study doctor about this risk. In addition, one of the risks of being in this study is that your personal information could be lost or exposed. This is very unlikely to happen, and we will do everything we can to make sure that your information is protected. Your condition will be watched closely during the study. If you have any serious reactions or problems, the treatment will be changed or stopped to protect your health. What are my responsibilities if I take part in this research? If you take part in the research, it is important for your safety that you follow the directions of the study doctor and research staff, tell your other healthcare providers that you are in a research study, tell the study doctor if you are thinking about discontinuing participation in the study. He or she will tell you how to stop the treatment safely. Will being in this study help me in any way? Taking part in this study may or may not make your health better. While doctors hope standard radiation and chemotherapy with XR400 added will be more effective than with antiprov added in slowing or stopping the growth of cancer cells, there is no proof of this yet. We do know that the information from this study will help doctors learn more about these therapies as a treatment for head and neck cancer. This information could help future cancer patients. Will being in this study cost me any money? There will be no additional cost to you from being in this research study. The medicines, clinic visits, and tests that are done for research purposes will be free. Any cost for the standard treatment of your condition will be billed to you or your health insurance. What happens to information about me? We'll try to limit access to your personal information, including research study and medical records, to people who have a need to review this information. We cannot promise complete privacy. The UMass Institutional Review Board, the study sponsor, and the U.S. Food and Drug Administration could inspect our research records to assure the study is being carried out appropriately. Your name will never be used in any results of the study that are published. If you test positive for HIV, hepatitis B, or hepatitis C, these test results will be reported to the local Board of Health and Massachusetts Department of Public Health as required by law. What happens if I am injured because I took part in this research? If you are injured while in the study, seek treatment and contact the study doctor as soon as you are able. If you are injured or have any harmful effects as a direct result of the administration of XR400 or any procedure required by the research, necessary medical treatment will be made available to you at UMass Memorial Medical Center. The sponsor, SimCorp, will pay the reasonable and necessary medical costs for study-related injury that are not eligible for billing to your medical insurance. To pay these medical expenses for a research injury, the sponsor will need certain information about you, such as your name, date of birth, and Social Security number. This is because the sponsor has to check to see if you receive Medicare. If you do, the sponsor must report the payment it makes to Medicare. The sponsor cannot use your information for any other purpose. The sponsor has no plans to pay for medical expenses for injuries that are not directly related to your research participation or that are caused by the natural course of your disease. The sponsor has no funds set aside for any other form of compensation in the event of a research injury. You do not give up any of your legal rights by signing this form. Will I be given any money or other compensation for being in this study? You will be reimbursed $75 at each clinic visit for your time, travel, and other expenses associated with this research study. In addition, free parking for all scheduled clinic visits will be provided to you during the study. SimCorp will be the owner of the study data. SimCorp plans to use the results and may obtain patents or sell the medication in the future or make profits in other ways. However, you will not receive any additional compensation. What are my other options? You do not have to be in this study. If you decide not to be in the research now or later, it will not affect your usual care and it won't be held against you. Your other choices may include getting treatment or care for your cancer without being in a study, taking part in another study, getting no treatment, getting comfort care. This type of care helps reduce pain, tiredness, appetite problems, and other problems caused by the cancer. It does not treat the cancer directly, but instead tries to improve how you feel. Comfort care tries to keep you as active and comfortable as possible. Talk with your doctor about your choices. What happens if I say yes, but I change my mind later? You are free to leave the study at any time. There are no penalties, and you do not lose any benefits to which you are otherwise entitled. It is important to tell the study doctor if you are thinking about stopping, so any risks from the treatment can be evaluated by your doctor. Another reason to tell your doctor that you are thinking about stopping is to discuss what follow-up care and testing could be most helpful for you. Can I be removed from the research without my permission? The person in charge of the research study or the sponsor can take you out of the study even if you don't want to leave. This may happen if the investigator decides that continuing in the study would be harmful to you, if you need treatment not allowed in this study, if you fail to keep your appointments or take the medications as instructed, if you become pregnant, or if the study is canceled by the company making the medication, the FDA, or the UMass Institutional Review Board. Whom can I talk to? If you have questions, concerns, or complaints, or think the research has hurt you, you can talk to the research team at this number, or contact someone from the UMass Institutional Review Board at the phone number or email listed here. Thank you for taking the time to review this presentation. Please click here to complete a brief survey.